Hi Laura, my name is Holly and I'm going to be your physical therapist today. How are you?
Good, thanks.
Good. Today I'm going to be looking at some of your breathing, and basically I'm just going to be teaching you what's called a sniff technique, and it works on strengthening your diaphragm muscle and kind of gets you knowing what you should be doing with normal everyday breathing as you go about functional activities and things like that, okay? The diaphragm muscle sits right here below your ribs, and when you breathe it actually presses down. So the first thing I'm going to have you do is get into what we call posterior pelvic tilt position, and that'll just kind of increase that cavity there so it has more room to go down. So you're going to flatten your back against the table. Good. And just go ahead and relax. And do you feel comfortable?
Yep.
Okay, good. Next thing I'm going to have you do is place one hand on your chest up here and another one on your diaphragm. And again, that's just right in between your ribs. Very good. That looks great. And first thing I'm going to have you do is I just want you to breathe normally, but take 2 deep breaths in through your nose and out through your mouth, if you would, please. Good. One more. Very good. Good. Now, did you notice maybe that one hand raised a little bit higher than the other when you did that?
Yeah, my upper hand.
Your upper hand, okay. So what that is saying is that you're using your chest muscles, the accessory muscles up here, a lot more than you are using your diaphragm. So this sniff technique is actually going to help you develop that diaphragm muscle and just allow for more efficient breathing, okay? Okay, so with your hand still there, this is kind of how it goes. So I'm going to have you sniff in 3 times through your nose and then breathe out through your mouth, okay? So can you go ahead and do that once for me? Good. And each time you do that, I'm going to have you do it one more time in a second, but each time you do that, I want you to be noting what is going on underneath this lower hand, okay? Can you do that again, please? Very good. Good. Does that make sense?
Yeah.
Okay. Next I'm going to have you do, we're going to progress it a little bit, and this time you're just going to do 2 sniffs and then out through your mouth. So, okay? Can you go ahead and do that? Very good. That seems to be making good sense to you. The third part of this, I'm just going to progress it a little bit farther. We're going to do 1 big sniff in through the nose and then exhale through the mouth. So, good. Can you do that once, please? Good. One more time. Good. And I do still feel that muscle working, so that's good. This time, instead of being loud with that first sniff in, I want you to try to make it as quiet as possible, but still be using this muscle. Okay, so can you do it just one more time for me, please? One more time. Good. All right, perfect. So what we're going to be doing with this breathing, this is just to help train your diaphragm, so you kind of know what's going on with this muscle. And so this time I'm just going to rest my hand on here, and I want you to take, just as we did in the beginning, I want you to take 2 breaths in through your nose, but this time focus on what is going on underneath your hand and my hand, okay? So just take a deep breath in through your nose, out through your mouth. Okay, perfect. That's great. Do you have any questions? Does that make sense? Okay, good. So what we're going to do is go ahead and continue on with the rest of your stuff. This will be a part of your home exercise program. I'll give you a copy on a piece of paper that you can take home and use. And yeah, we'll come back later in the session, and I'll have you teach me and make sure that you understand what's going on, okay?
Okay.
Okay, thanks, Laura.
Yeah.